Welcome to Kaleida Health's Medically Speaking. I'm your host, Mike Hughes. On today's show, we're going to talk about the flu and its impact on Western New York. Today's guest is Dr. Dave Pierce, the Chief Medical Officer for Millard Fillmore Suburban and DeGraff Memorial Hospitals. Dr. Pierce is a board-certified emergency room physician and a subject matter expert on influenza. Dr. Pierce, thanks for joining us.
Thank you.
We continue to hear that the flu is hitting Western New York hard. Tell us a little bit about what's going on in Western New York.
Yeah, so over the past probably 3 to 4 weeks, we've seen a significant increase in the number of flu cases, and not just influenza. What I would call influenza-like illnesses has skyrocketed as well. And you don't need to go very far. Just in talking to people in the community, you know how hard this community is being hit right now with influenza. So if you look at the United States as a whole, the United States was hit very hard very early with influenza-like illnesses. Western New York and New York in general caught up a little late, but I will say that over the past 3 weeks, we've seen a significant increase, especially in the emergency departments, but also primary care doctors' offices, urgent cares, and just any of the people that you talk to, you know how hard people are being hit.
Right. So talk a little bit about, you mentioned influenza-like cases. What's the difference between a cold and the flu, and how does someone know the difference?
So when you look at what the CDC publishes, and the CDC really puts out data that refers to influenza or influenza-like illness. So an influenza-like illness is typically something when you're not dealing with flu, which could be a rhinovirus, your common cold. Those are things that typically present with a little bit of runny nose. You can have a little bit of an elevation in your temperature, some cough, not so much with a huge amount of muscle aches, whereas the influenza is very sudden onset, very high temperatures, significant muscle pains to the point where sometimes people can't even get up and walk because they have so much rigor, and cough, sore throat, and really debilitating symptoms. And that's kind of how you differentiate the two of them. But those are the types of things that we're seeing, really, to be quite honest with you, a high incidence of both of them right now.
Right. So there's always an emphasis on getting the flu vaccine every year. First of all, is it effective? Second of all, is it too late to get the vaccine?
So I'll answer your second question first, is that you should absolutely get the vaccine. If you haven't had the vaccine, that is the single best thing that you can do to protect yourself from influenza. And with regard to effectiveness, the way that we look at vaccine effectiveness really comes from some of the leading indicators. So Australia gets hit with flu before we do, typically in every season. So we look to them to see how well the vaccine does with influenza. And this year in particular, the vaccine is not as effective as we would like it to be. So there have been numerous reports, although the CDC hasn't published data. There are a lot of experts saying that it could be as low as 10%, 15%. And when you look at Canada, Canada's also seeing some of the same data. And in talking to people in this community, I've seen, just on a personal, anecdotal basis, I've seen numerous people that have had influenza, positive, that have had the vaccine.
So there's been talk that this current influenza virus that's going around has mutated a few times this season. Talk a little bit about that and how that tends to occur as the flu season wears on.
So influenza isn't just one virus. Okay, so influenza, there are multiple viruses, and without getting too deep into this, you have an H1N1 and an H3N2, and just considering those two for a minute. The H1N1 is a relatively stable virus, comparatively. So when the experts look at developing a vaccine and they say, we're going to develop a vaccine, we're going to include that virus in our vaccine, by the time the vaccine is made and you contract the virus, that's a relatively stable virus, and it's typically very effective. And in a good year where you match it well, it could be up to 60% effective. The other side of that is this H3N2, which is currently what's circulating very heavily in the U.S. right now, and particularly in Western New York, is that this is a virus that even in a perfect year where you match it very well, put it in the vaccine, and that's the virus that circulates, even in a good year, you might only get about 30% effectiveness. And largely because number one, it's grown in eggs. And when it grows in eggs, there's something called egg adaptation. So the virus changes a little bit. So what you think you're starting with is not what you end up with in the end. And then this particular virus also mutates very quickly. So it's in this year, we actually included the H3N2 in our vaccine, even though that's what's circulating. The common thought right now is that it's mutated so many times that it's not as effective as we would have liked it to be.
How do you address the skeptics? One are those who believe, well, I'm not going to get the flu shot because I'm going to get sick from getting the flu shot. And then two, I hear about all this talk of the virus is mutating, so even if I got the shot, it's not going to work. Talk about how to address the skeptic. Why is the vaccination important?
So there's a couple of reasons around why it's so important. Is number one is that when people say that they don't want to get the vaccine because they will get influenza, that's not true. The vaccine is inactivated, so you take a little piece of the virus, so you don't actually give people influenza to have them build up a response. You're taking a piece of it that can maybe give you a little bit of muscle aches, a little bit of fatigue, but you're actually not infecting them with the virus. So the whole point in doing that is that when you give them that, your body recognizes it and says, this is not what's supposed to be in my body, and you start building up an army of antibodies. It takes 2 weeks to build up an effective group of antibodies that if that virus then infects you, you're ready for it. So it fights it off and you do exceedingly well. Even if you get the vaccine and you're talking about a mutated virus, it does contain other viruses. It has H1N1, it has influenza B in it. So, and having some of the antibodies against that virus, even though it mutates, when you get that virus, if it has mutated, you might get some of the symptoms, but they're likely not going to be as severe as if you had no vaccine at all.
Gotcha. So it's now early February. Our hospitals are extremely busy. So it's the flu, it's influenza-like symptoms. Talk a little bit more about what we're seeing across all the hospitals and the patient load that's coming in.
The patient loads have been extraordinary. The number of patients that are coming into the hospital being admitted with either influenza-like illnesses is extremely high. And the reality is that the people that are hit the hardest are people that don't have the best immune systems. So someone who is very healthy, has a very good immune system, these are people that might be able to fight off a lot of the symptoms at home, go through some symptomatic treatment, whereas people that might have chronic lung disease, liver disease, heart disease, neurologic disease, or people that are on the ends of the age spectrum, so young people that might not have developed an immune system yet, or older people that it might not be what it was, tend to be hit much harder. And those are the types of people that we're seeing, that maybe in a common cold wouldn't need to be admitted to the hospital, but with influenza, it's tipping them to the edge where they really do need a higher level of care.
So you mentioned the primary care offices are busy. We talked about the hospitals are busy. What's the proper steps that a family, a mom, a dad should take with someone who is sick or someone themselves who may feel like they have the flu? Do they go to their primary care doctor first? Do they go to urgent care? Do they go to the emergency room? What's the proper step? What's your advice for people?
So what I would normally tell anyone is that the first stop would be your primary care physician, whether it's your pediatrician, whether it's your primary care doc. Call the office, and the reality is that those people will typically know their patients far better than anyone else, and they'll know their comorbidities. They'll know all of the other things that might make them more susceptible to having complications. So my first call would always be to the primary doctor. This is what I'm having. These are the symptoms that I'm having. What do you think? And that would be the first step. And I would say that if you don't have a primary care doctor, or you can't connect with them for whatever reason, and there's a significant amount of concern that you have, going to an urgent care would probably be the first step. But I will say that if you have severe symptoms, significant difficulty breathing, there's confusion, there's really debilitated, unable to take in any fluids to the point of getting dehydrated, those are things that it's always reasonable to come have an evaluation in the ER. But I will tell you that just going for a quick look without talking to the primary doc leads to significant wait times, a big waiting room, and that ultimately ends up really jamming up a lot of the emergency departments in the area.
Right. So someone is diagnosed with the flu, and it's the virus that's going around. How long will that last? What are the symptoms, and how long will they last? So someone is sent home. Maybe they're not hospitalized, but they're sent home with their prescription. All that. How long can someone expect that to last?
So influenza, and it really depends, and influenza can last from anywhere from 2 days to 2 weeks, and a little bit of it goes back to what we talked about earlier, which is did you have the flu vaccine? Did you have some immunity built up before you had the vaccine? And the other part of it is obviously do you have other health conditions that might delay your
Right.
that healing time? So there's no right answer to that, but some people could feel pretty miserable up to 2 weeks.
So someone at home has the flu, they're recovering from the flu, they're getting over it. How do you recommend people clean up their house, stop the spread of the virus?
This is the greatest thing that you have to impress on people is that flu is, when you cough, it's airborne droplet. It flies out, or if you touch mucus or you touch your saliva and people touch things. So the greatest thing you can do to help yourself is clean your surfaces, wash hands. If you don't have soap and water available, use some of the gels that actually kill viruses. None of them are 100% effective, but something is better than nothing. And the other part of this is that if someone's recovering, trying to keep them out of the general population, the recommendations are really you want to be without a fever for at least 24 hours before you're going back out into the public. So those are some things that you can do to, number one, help prevent anyone else from getting it, and then exposing other people in the community.
So you talked about keeping them out of the general public. So keeping kids home from school, keeping them away from their youth sports. For adults that maybe not going to work for a day, as hard as that may be, how important is keeping them out of that general population in terms of trying to control the spread?
It's very important, it's a fine balance. You don't want to swing too far to one side and say that people are going to be out of work for 2 weeks, even though they're just having very minor symptoms toward the end of it. But the recommendations are really no fever, feeling at least relative improvement, and then just engaging in very good hand hygiene. When you cough, when you sneeze, things like that, using something to cover your mouth, not just sneezing out into the public. Those are all things that are very important to prevent spread.
So you've been in the emergency room for quite some time now. Compare this to other seasons of the flu.
This is a bad flu season. I just went through some of the statistics from the CDC, and over the past 34 years, the month that flu typically peaks the most is in February. That's the highest. December next, and then usually in March. So we've seen a very high number of cases in January. And the reality of it is, if you look at the number of cases, it doesn't show any signs of going down right now. So it's not that we started early, but we got up to a peak very quickly. And the reality is we might have a significant February as well. But there are a lot of people with influenza coming in, and I would expect that over the next month we're going to continue to see some of those numbers rise.
So last question. Flu season isn't over. It's on the rise. It's obviously very serious. What can we as a community do to help combat that?
So some of the things we talked about, making sure that you're washing down surfaces, making sure that you engage in good hand hygiene, that you're very cognizant of, sneezing, coughing, making sure that you cover those things up, staying out of the community if you have those symptoms and you have a fever. And the number one thing is that it's not too late to get the flu shot. If you have not had the flu shot, that is the number one thing that I would recommend. Now, you can get that at your primary care doctor's office. The pediatrician's offices often set up flu clinics. You can go to Wegmans, Tops, Rite Aid, and even within the hospital, you can go to the outpatient pharmacies. The emergency departments typically don't give vaccines, but any of those areas, you can walk in without an appointment and get a flu vaccine today, right now.
Great. Dr. Pierce, thanks for joining us and talking about such an important subject.
Thank you for having me.
And thank you for joining us on Kaleida Health's Medically Speaking. I'm your host, Mike Hughes. Hope you will join us again.